Hi, I'm Dr. Ramey Turner, also known as Dr. Tin Man. I'm board certified in family medicine and have a telehealth service in Texas, which you could go to at rameyturner.com. However, I'm here today to talk to you about the 3 things that I wish my patients understood best about congestive heart failure. But before I do that, I need to put up my disclaimer, which explains that I'm not your doctor. If you have a medical emergency, please call 911. This video is for educational purposes only, and talk to your doctor before you make any changes to your healthcare because everyone is an individual with different needs. Now that I got that out of the way, I don't need to forget to ask you to please like, subscribe, and share because that's part of the metrics. But do share if you feel like this is helpful to someone else, and do like if it does provide benefit for you or you believe it would benefit someone else so that more people can learn. Having said that, the most important things to know about congestive heart failure basically are centered around weight gain or loss, your blood pressure, and your medications. There are other things you can do to help with congestive heart failure. It is not curable and it is serious, but it can be managed and you can have a good quality of life, especially if you catch it early and you work hard to keep these things under control. Now, the first thing to worry about is your weight, because weight indicates a water change if you gain 5 pounds overnight. So what I want you to do is get up in the morning, first thing, go to the bathroom, take off as many articles of clothing you are comfortable with, and stand on the scales every single morning and write that down in this log. If you have gained 5 pounds or more, go ahead and check your blood pressure and see what it is. We'll get to blood pressure in a minute, but you want to see what you've done. If you've gained 5 pounds, that means that you've consumed 17,500 calories, and I just highly doubt that happened. So, it's probably water. And it's probably in your legs, and it's in your lungs, and it's going to make it hard to breathe. So you want to get that water off. So, hopefully you've made a plan with your doctor about what to do if that's happened. And that's where sometimes the disconnects occur. So, call your doctor if you've gained 5 pounds and ask if that's okay or if there's something that you need to do about that. The second thing that I feel like is most important to know is to know about your blood pressure. Because when you come to the doctor's office, your blood pressure is going to be higher almost always. Almost always. And so in trying to determine what's best for you to take, we need to have an idea of what does your blood pressure do when you're at rest. So go home, chill out on your sofa or your easy chair, whatever, sometime after you're really feeling rested and chilled out, and see what your blood pressure looks like then. So hopefully you have an automatic blood pressure cuff that looks something like this. Check it, write it down. That goes in your normal, everyday blood pressure log. If it's always really stable and nothing really changes, it's okay to skip a few days, but basically that's where it goes. If something has changed, your weight has increased or decreased, you're feeling dizzy, you're feeling fatigue, you feel like you're having some exercise intolerance, these kind of symptoms, check your blood pressure and see what it's doing at that time and write that down. Those are important things to know. And then take that log with you when you go to the doctor's office. In the last column is your medications. Write down every medication you take, and then if there is a change when you go to the doctor's office, on that date, write down the change, and you may need to mark out and rewrite your medication that's been changed to a new medication, but it's always on the list. If you have diabetes or anything, feel free to add extra columns. This is just an example that I've given for you for a log to keep track of these things. So basically that's it. You just are watching your water weight, making sure that you didn't gain or lose too many pounds. You're watching your blood pressure to make sure it doesn't go too low and that it's not going too high. You may need more blood pressure medicine. And you're knowing your medications. Ask your doctor about what your medications do, which ones come off, which one come on, what do you need do you need to wait any periods of time before you take one or another, and even after you've done all that, hey, Dr. Google is still there. So go on there and look at drugs.com and see for yourself what you need to watch for, because they may not realize that you've already had some kind of reaction that's similar to this. They may not realize that you're predisposed to certain conditions, and you may not realize a side effect that's occurring to you is because of your medication. So know your medications. Learn them for yourself, because you're the one that's ingested them and it's your body. I know it's the doctor's responsibility to explain these things to you, but the list is like this long and the time is about this short. So do the best that you can for yourself. I will do a short course on medications. If anyone's interested, please let me know in the comments and we'll go from there. Thank you very much for watching. Please like and subscribe and share. Thanks. Bye-bye.